are asking a question about what will be the cause of poor growth during a hair transplant. There are many causes. There are many factors that can lead to poor growth. There are factors that are operating dependent. The doctor first, what is skills? The team and the physiology of the patient. Patient who may have some scalp diseases like lichen planopilaris. Patient that will be misdiagnosed for androgenetic alopecia that can be combined with other diseases. So those are medical conditions. That's why it's important to see the doctor. It's important to check and do a dermoscopy to make sure that there is no scalp disease that could create a problem for your growth. Then it's important to check donor. If patient has a lot of miniaturization, most of this hair may not survive surgery and will lead to poor growth. Then the experience of the doctor when he's punching, his transaction rate, the ability for him to check himself, to look on a microscope to see how intact his follicles are. Then the technician, when they process the graft, sometimes I see video of clinic showing how they extracting. They pull the graft with no regard because they're so happy to harvest so many grafts per minute. But the way they pull them, you know that most of the graft will not survive. Then I always tell my team, grafts are like fish. They need to survive in a solution. So if the grafts are left outside for longer enough, they may dry and not grow. So you have the transaction rate, but you have also the handling of the team. And then during placing, if the team are using forceps, if they're using implanter, the way they push, they can crush the graft. So there are several factors that can lead to poor growth, from patient's own physiology to the handling of the graft by the team and the doctor to the expertise of the doctor. All that will play a role. So it's not just a simple answer what causes poor growth. Poor growth can be a combination of a lot of factors. That's why personal consultation is always important, because it will also have an impact on the outcome. Another thing, patient who smoke, patient who take some medication after surgery can also have an impact on the growth. So it's important to know that.
Hey, thank you so much for watching our video. Please go to bhrclinic.com and why not fill out our online consultation form to have a free appraisal. Let's get started together. Look forward to seeing you soon.